is Jamie. I'm a PN student at Wilson State College. Today I'm going to be performing vital signs. Right now I'm outside my patient's room and I have just performed hand hygiene. Hello, how are you today?
Good.
Now I am also going to perform a gel-based hand hygiene, and I'm going to rub it together until it is dry. Okay. Can I get you to verify your name and your date of birth for me?
Bailey Hagan, 7/17/1997.
Okay, perfect. Okay, so today I'm going to assess your vital signs. Do you have any questions before I get started?
No.
So first thing I'm going to do is I'm going to take your temperature, and this is with a tympanic thermometer. I have also disinfected this before use. Okay, so I'm just gonna turn it on. There we go. And to do this, I'm gonna have to grab your peanut, pull up and back. Is that okay?
Yep.
And it'll beep when it's done. So 97.3. Looks good. Now we'll dispose this. I will then disinfect again. Second, I'm going to check your oxygen saturation. If I could just take your hand. I check and make sure that her nail beds are good, there's no fingernail polish, and the color looks great. Do you have a finger preference?
Just the index is fine.
Okay, so we'll just, there we go. Alright. 98, good, that is perfect. I will also disinfect this. Now I am going to listen to your apical pulse, which is located, if you check the sternum, go over to the left mid-clavicular line and then down in between the 4th and 5th intercostal. And to do that, I'll have to go underneath the shirt. Is that going to be okay?
Yep.
Okay. And while I'm doing this, I'm going to go ahead and put your hand right here. While I'm doing this and listening to it, I am also going to be checking your radial pulse to make sure everything's in sync with each other. Okay. And I will be doing this for a minute. Everything looks good. Your pulse right now is at 97 beats per minute. Okay. Now I am just going to take your pulse and just check it again here. And while I'm doing this, without the patient knowing, I will be checking their respirations to see how many they have per minute. About 18 per minute respirations. Next, I'm going to take your blood pressure. Do you normally know what your blood pressure is?
Usually on the lower end of normal.
Okay. Alright. So to do this, I'm going to make sure that they have the appropriate clothing right here or to lift up so it doesn't restrict anything towards the blood pressure cuff. And what I'm going to do is make sure that the cuff is about 1 inch above the antecubital fossa. And then I want to make sure that the cuff is lined up with the artery right here. And I want to make sure it's tight enough, but not too tight and not too loose to where it can fall down. So I am then going to find the brachial artery with the stethoscope here, and I'm going to press on it while I take her blood pressure to listen. Okay. So it is about 118/80. Do that. Okay. And then last, I am going to check your dorsalis medius pulse, which is in your foot, if that's okay. So what I'm going to do here is I'm going to go between the first and third toe, and I'm going to kind of go up here and make sure I use 2 fingers, and I will count for another minute. Now everything looks good there. I am all finished. Did you have any questions about your vital signs before I take off?
No.
Okay. And I will make sure, again, to disinfect all of my equipment. And I am also going to use a gel-based hand hygiene here before I leave the room. And then when I leave the room, I will then, again, use hand hygiene, proper hand hygiene.